In this video, I will be going over a health lesson for Shadow Health community. So the health risks identified, the most important being smoking. So we'll go over objective one, which is identifying your health risks. So what is smoking? We'll go over what are the health risks of smoking and what are the economic and social costs of smoking. So, smoking is defined as the action or habit of inhaling and exhaling the smoke of tobacco by sucking on the end of a lit cigarette, cigar, or pipe. So, in the United States, according to the CDC, using tobacco products continues to be the largest preventable cause of illnesses and mortality. Nearly 1 in 5 US people, equivalent to 49.2 million, are reported using tobacco products in the year 2022. So, again, according to the CDC, there are multiple health illnesses that you can acquire strictly from smoking. So, these include cardiovascular diseases such as heart attack or stroke. You can also get some respiratory issues such as emphysema, chronic bronchitis, lung cancer. There's an increased risk of various types of cancers, some being mouth, throat, pancreas, bladder. Um, you can also have a reduced immune function. So, this is going to cause more infections. Reproductive issues are also seen in both women and men, which can have a negative effect on pregnancies. So, low birth weight, premature birth, or fetal nicotine syndrome. So, some economic and social costs of smoking. Of course, there's a stigma that's connected with smoking. So, daily social contacts, it can lead to reduced self esteem, decreased efficiency, and resistance to quitting. According to the CDC, again, there's an estimated cost of smoking cigarettes in the United States. It's more than $600 billion in 2018. So a breakdown of these costs would be over $240 billion spent on healthcare related to health issues that are associated with smoking. So smoking related illnesses and health issues costed some loss of money of around $185 billion. The loss of output from smoking related premature death is close to 180 billion, and then the estimated loss productivity due to early deaths from secondhand smoke exposure is $7 billion. So, objective two of this healthcare plan is to recognize triggers and behaviors associated with smoking. So, we'll go over what are some triggers and what are some personal patterns and behaviors of people that smoke cigarettes. So, common triggers involve emotional triggers, some environmental triggers, or routine triggers. And a trigger can be identified as activities, situations, or feelings that make a person want to smoke. So, to get more in depth, emotional triggers can include anxiety, frustration, sadness, stress. And the most common feeling that triggers smoking or wanting to smoke is being anxious or being stressed. Some environmental triggers could include friends who smoke. So being around a friend who smokes may make you want to smoke. Or being at a party or a bar and you see other people doing it may make you want to do it. And then there could be the routine triggers. So you're used to doing it after meals or during a lunch break, something like that. So it becomes a habit. So behavioral patterns associated with smoking. Of course, tobacco, um, it's a chemical, so it makes you experience an increase in feeling when you're smoking. So there's pleasurable feelings that are associated with smoking, and it makes it difficult to quit. So the more you smoke, the more you feel like you need to smoke. The third objective is to apply effective strategies. So this is where we teach people in the community how to stop smoking. So step one is to set a quit date. And step two is to build a long-term success plan. So setting a quit date, that looks like when you decide to stop smoking for the first step. So that's step one. But following that, you need to have assistance and things in place to make sure that you follow through. So you want to allow for time for preparation. So you may pick a date next week to stop. And in your mind, you're building up to that. Be ready to have people to help you, people that will build your self assurance and your ability to quit smoking. And then you also don't want to wait too long. Um, Having more time to think about it could alter your mind and make you want to decide not to. You could lose your motivation. So you want to select a date that is within the next week or two. So building a long-term success plan. Like, the most important thing is to know your triggers. So if you know you're going to stop, then you want to know what to avoid so that you can continue to stay on the path of not smoking. You want to make a list of activities that you can do to help resist the impulse to smoke. Um, that may be working out, engaging in deep breathing exercises, whatever seems right. You also want to treat yourself regularly. So reward yourself for sticking to the plan. It doesn't have to be anything big. Just give yourself a pat on the back. And also you want to obtain assistance from those in your immediate family. So your friends, your spouse, that can be beneficial. So speak with the people that helped you quit smoking in the beginning, and I'm sure they'll have your back. All right. That's the end of the presentation.